Good afternoon, everyone. I'm Dr. Nagraj from IIP Digital Media Team. I'll be host for today's webinar on empowering women one progression at a time, making strong women, strong bodies, and strong lives with resource person Dr. Amrita, being organized by IIP Women's Cell Nashik district. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IIP digital media team consists of a group of physios who handle Zoom platform, webinar, live streaming, and IIP profiles on social media platforms like Facebook, Instagram, Twitter, LinkedIn, YouTube, and follow IAP profiles on these social media to receive notifications for our events such as webinars, workshops, CMEs, conferences, and health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notifications of our live webinars. In playlist section of this channel, webinars are segregated into various folders on topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health and research, cancer rehab, etc. For easy access, the social media links will be shared in the chat shortly. Without much wasting time, I would like to give hand over to Dr. Pakshaman. Over to you, ma'am.
Thank you, Nagraj sir. A very good afternoon, everyone. On the occasion of International Women's Day, 8th of March, held each year, Indian Association Physiotherapist Women's Cell Nashik District Team, myself, Dr. Paksha Kamble, District Coordinator, and Dr. Ankita Hase, District Sub-Coordinator, welcome you all for today's webinar, Empowering Women One Progression at a Time, Making Strong Women, Strong Bodies, and Strong Lives. A woman goes through dynamic phases of life like personal growth, cultural, societal roles, emotional journey, and health and well being. Now, biologically, where health and well being is concerned, her life is impacted by physical health, reproductive health, childbirth, menopause, and more. As the theme for International Women's Day 2025 suggests,
Ma'am, keep your
accelerate
microphone little near to your mouth. Microphone. Yeah.
As the theme for International Women's Day 2025 suggests, accelerate action, we thought of empowering women's life by accelerating her each progression, but finest rehabilitation she may require in her life at every phase by making her strong, her body strong, and her overall life strong. I hand over to Dr. Ankita to introduce to Indian Association Physiotherapist Women's Health.
Thank you, Dr. Paksha ma'am. I would give a small introduction to IIP Women's Cell. IIP Women's Cell functions under the guidance of National Head Dr. Rucha Vashne, IIP President Dr. Sanjeev Jasar, and we have 5 zones in India with heads for each. Dr. Pooja Kamre is the West Zone head, and the state team head of IIP Women's Cell Maharashtra includes State Coordinator Dr. Suvarna Ganveer ma'am and Joint Coordinator Dr. Snehal Patel. Sub-coordinators Dr. Uttara Mohan, Dr. Priya Karande, and Dr. Nirali Sangvi. We have 22 district committees in this state. In Maharashtra, IIP Women's Cell has conducted many low-cost activities like CMEs, workshops, conferences, webinars, public awareness campaigns, and health camps in various districts since 2018. In the year 2019, 2021, 2022, 2023 and 2024, IIP Women's Cell Maharashtra has received awards for the best IIP Women's Cell state team. I would like to hand over to Dr. Paksha Kamble.
Thank you, Dr. Ankita. Indian Association of Physiotherapy Women's Cell Nashik District Team is pleased to have you all with us for this energized and informative session, led by our expert panel speaker, Dr. Amrita Tomar ma'am. Today's webinar is all about empowering women one progression at a time, making strong women, strong bodies, and strong lives, which shall be defined under the subtopics pregnancy and postpartum physiotherapy, hormonal changes and their impact on women's musculoskeletal health, menstrual health, and physiotherapy. Our speaker is a passionate physical therapist with more than 11 years of clinical experience by working in multi-specialty hospitals. She had been HOD at Sayadi Multi-Specialty Hospital, Nasik, from the year 2016 to 2020. She had been consultant physiotherapist at Dhadibal Orthopedic Hospital, Nasik, from the year 2016-17. She has also worked at KRIMS Multi-Specialty Hospital, Nagpur, in the year 2015. She had worked for Sanjeevi Institute for Orthopedic and Rehabilitation, Pune, in 2013-2014. Moreover, she has a chapter published in a book named Menopause, Past, Present, and Future by Kanchan Sorte and Parimal Taide, published on 27th June 2023. She has a journal publication named Effect of Breathing Exercise on Lung Functions in Postpartum Mothers with Normal Vaginal Delivery in the Indian Journal of Physiotherapy and Occupational Therapy, 2014. Currently, ma'am is working as assistant professor at SEF Suryadatta Institute of Health Sciences College of Physiotherapy, Pune. She shall be sharing her immense knowledge and highly defined technical skills to us. Throughout the session, we encourage you all to actively participate by submitting your questions in the chat. And at the end, we shall be dedicated some time to allow you all to address your questions. So please feel free to engage with us. We hope you find today's webinar both educational, inspiring, and you all walk with valuable takeaways to apply in your technical skills. Now let's dive into the webinar. I'm excited and hope you are too. Now I hand over to our speaker, Dr. Amrita ma'am, to guide us further.
Hello, good evening, everybody. Am I audible?
Yes, ma'am.
Yes, ma'am.
Okay, I'll be sharing my slide. Is it clear and visible?
Yes, ma'am.
Yes, ma'am. Ma'am, make it slide sorter. First slide.
Just a second. Is it okay now?
Yes, ma'am. You can start.
Okay, good evening, everyone. My topic today is empowering women, one progression at a time, making strong women, strong bodies, and strong lives. I, Dr. Amrita Altomar, your speaker of the day, would like to express my sincere gratitude to Dr. Sanjeev Jha sir, to Dr. Ruchi Vashne ma'am, to Dr. Pooja Kamble ma'am, Dr. Suvarna Ganveer ma'am, Dr. Snehal Patel and Dr. Uttara Mohan, and my dear Nashik team, Dr. Paksha Kamble and Dr. Ankita Shrikant. Thank you so much for giving me the opportunity to speak in the IAPWC platform. I would like to thank my principal, Dr. Simi Ritharikar ma'am. She's from SEF Suryadatta Institute of Health Sciences, College of Pune, for continuously encouraging and supporting me. I would like to thank my guide, Dr. Manisha Rathi ma'am, who is currently principal at Khyati College of Physiotherapy, Ahmedabad. She refined me enough to make me capable of speaking in front of you all. As we are continuing the celebration of Women's Day 2025, this year's theme is Accelerate Action. And what do we understand by accelerate action? Accelerating action for gender equality. And gender equality is addressing the systemic barriers and biases that women face, both in the personal and professional grounds on day-to-day basis. Accelerate action to speed up the rate of the progress worldwide. I don't need to go deep in this because we all are aware of our situation. But since when is the same situation? One of my batchmates yesterday shared one article because the title caught my interest. Physiotherapy, a feminine profession. In this article, they mentioned certain female dominant professions like nursing professions. And then I got started reading this article and came to the lower end of this. It is the Australian Journal of Physiotherapy, and the volume is 32. It was issued 4, and the date was 1986. So since then, we are into the same profession, the feminine profession, and continuously trying to grow it bigger. 1986, and currently we are in 2025. The problem they pointed in 39 years ago, it looks same to me today. So we started from nowhere, and now we are here, still a long way to go. So is the need to accelerate our actions. Action on the right path, action with the right guidance, action with the right approach and preparedness. On this thought, for our profession, let's accelerate this webinar to my today's objectives. And they are to enlighten you with the role of physiotherapy in pregnancy and postpartum period, to explain hormonal changes and their impact on women's musculoskeletal health, and a bit about role of physiotherapy in menstrual health. As my audience is mostly undergraduates today, I will try to keep it as simple as possible to understand. Let's start with the pregnancy and postpartum physiotherapy. What do we understand by antenatal period and the postnatal period? Antenatal period is it begins right from the conception till the time you deliver. And the postpartum period is right from the delivery of the baby to, it lasts up to 6 to 8 weeks, but for completely gaining control over your body and your musculoskeletal system, it takes around 6 months for complete recovery. What we do in the antenatal exercises. Here we are trying to segregate into antenatal and postnatal period physiotherapy. Antenatal exercises, women in good health should be encouraged to engage in the regular moderate intensity physical exercises during a normal uncomplicated pregnancy. And thorough medical evaluation should be conducted prior to prescription of the specific exercise program. Without consultation of doctor, I strongly disagree to not start the exercise programs. Why? Because there are certain underlying illnesses and there are certain underlying conditions which we are not aware of, as we all are not physically active these days. What should be the aims of these exercises? To improve the physical and psychological well-being of the pregnant woman, to prepare them for the labor and delivery, to reduce the risk of the pregnancy-related complications, to help them manage musculoskeletal pain, to improve their posture, and to promote healthy. Excuse me, can't see here. Am I audible?
Yes, ma'am.
Okay. Just a second, some glitch I'm facing. Dr. Nagraj?
Yes, ma'am, you are audible.
I can't see my slide.
Maybe due to the bandwidth of the network.
I'm not sure. But
Can you just stop sharing the screen and again reshare, ma'am? It will be okay.
I'll try. Is it visible for you all?
Yes, ma'am. You can make a slide sorter.
Okay. So we were on the last slide to promote the healthy weight gain of the mother. Okay. Is it okay if I share it in this manner?
No, ma'am, it will be looking too small, so you can make it a big screen slideshow.
Fine.
Yeah. Yeah. Now, can you change, ma'am?
Yes.
Yes, ma'am.
Before diving into the exercise, what is the important thing here? Safety first. That means you have to rule out the contraindications first. So what are the contraindications during the ANC period, during the first, second, and third trimester? The absolute contraindications are placenta previa. And the placenta previa is the condition in which the placenta covers the cervix. It is near around the cervix area. So that is the absolute contraindication. Incompetent cervix, if the cervix is not able to support the pregnancy. Second and third trimester bleeding, if there's any kind of bleed, you stop suddenly. You don't do any of the exercise. Even if you are okay in starting first trimester and second trimester exercise and the bleeding up starts, you have to stop and cease the exercises immediately. Preeclampsia, that's high blood pressure and the organ damage. That's the exercises are not recommended in such condition. Ruptured membranes, if there are ruptured membranes or the water is breaking, you cease the exercise. These are the absolute contraindications. There are more. Premature labor, if the contraction starts beginning, you should stop exercises. Multiple gestations at risk for premature labor, like if there is twin pregnancy, triplet pregnancy, exercise is not recommended. They starting trimesters, yes, you can do the exercises, but only under supervision. Gestational hypertension, high blood pressure during pregnancy, which can be a risk of preeclampsia because exercises will increase it further. So no, exercises are contraindicated here. Significant heart or lung disease. If the woman has pre-existing heart or lung condition, she should exercise under medical supervision. Severe anemia, low red blood cells count can make exercise less safe because it will not be able to pump out enough oxygen. Now, what are the precautions to start PNC exercises? Post-PNC, we are like postnatal exercises. You have to consult healthcare provider, OBG, or a surgeon first, that you get clearance for the exercises. Before starting any exercise program, it is crucial to get that go ahead from your doctor or midwife, especially if you had a cesarean section or any complications during pregnancy or delivery, because they don't share everything on the note. That's why you need to consult them and ask them that you are fit for doing the exercises or not. They can assess and discuss your individual needs with a PT, that why do you want exercises? What is your goal for the exercises? Then your PT will assess you for the specific situations and recommend an exercise program and activities for your recovery. The second important rule is for the exercises, start slowly and gradually. Begin with gentle exercises first, as basic as ankle toe movement, as basic as moving your upper limb and lower limb. Start with lower impact activities like walking, gentle stretches, pelvic floor exercises. Listen to your body. Pay attention to your body's signals and don't push yourself too hard, especially in the early stages of recovery. Increase intensity and duration gradually. As you feel stronger and more comfortable, you can gradually increase the intensity and duration of your workouts. Third important thing, avoid high impact activities. Delay high impact activities like running, jumping, aerobics that you have gained sufficient strength and ability. You have to wait. Like most of the time, my patients, they ask me that, ma'am, when can I go back to the gym? So I tell them no, strict no till the 6 weeks post. And after 6 months of basic exercise program, then you can gradually go on to the gym activities on the high intensity. Focus on low impact options like walking, swimming, cycling, which are gentle on your joints and pelvic floor. Now pay attention to your pelvic floor. Strengthen your pelvic floor by doing pelvic floor exercises. It's some crucial part in postpartum recovery, because sometimes even if it is normal delivery, you have done incisions for the delivery of the baby, so that it takes time for healing, and it causes incontinence and other pelvic floor issues in many cases. So avoid exercises that strain the pelvic floor. Be cautious of exercises that cause you to bear down on your pelvic floor muscles, such as certain abdominal exercises or weightlifting. That means you should not be increasing the pressure on the pelvic floor. Stay hydrated and nourished through and through the exercises. Like if you're opting for exercising around 8 a.m., so you should have some light meal or hydrated enough by 6 to 7 a.m. So staying hydrated is important for overall health and can help prevent dehydration, which can affect milk supply in breastfeeding mothers. So hydration is most important for them. And check on your diet. For that, I would recommend to go to a dietitian and get a full diet plan for yourself. How to prescribe these exercises now? We learned about ANC conditions. We are not giving exercise. We know the full block in which the exercises are contraindicated. We know now when and what exercises can be done during the PNC. Now, how to make a protocol? It is a big question for the physiotherapist. So you always go back to the basics for that. And there's a FIT principle given in the book. FIT means frequency. That means the number of repetitions you are going to do. Intensity. That means the holds and weights. Intensity you can increase by weights or by holding the contraction of the muscle. Time, for how long, for how many counts, how many repetitions, and the type, what kind of exercise. There should be always one sequence of exercise that should be followed for everyone in the general exercise prescription. That is warm-up. In the warm-up activities, you can see the ankle pumps can come, isometrics can come, pre-movements of the upper limb and lower limb can come. And the selective stretching, then you start stretching your body. You can do Tadasana. You can start stretching your quads, hams, TA, basic, and upper limb stretching, lateral stretching. Then aerobics, it's fast jogging, walking, can work. Postural exercises, you have to correct the posture in which the mostly you can see the women, the protracted shoulders and the forward head posture. So for them you need to give the corrections. Strengthening exercises, then we start with the gradual weights, minimum like half kg, 1 kg, and then we progress them on. Then we teach them pelvic floor exercises. Certain exercises which needs to be done on the spine line position. They can also do it in the sitting and the standing position. Cooling down after doing all of this, you can say vigorous exercise protocol, you need to cool them down with again, same activities we did in the warm-up session. Last but not least is the relaxation, which is important. You can incorporate it with the Shavasana and Jacobson's relaxation methods. Deep breathing exercise is most important in this. Certain forms and if you are doing the exercise under prescription or under someone's supervision, if they are doing the exercises, that's yes, they can definitely go for the exercises with balls, physio ball. They can even start with the light gym, but that should be under supervision only. And the activities of daily living which they are doing, they will be enough for their day for exercising. Postnatal period for healthy pelvic muscles. So first topic is over and I'm going on the second one. It's a postnatal period for their pelvic floor muscles. In the Kegel exercises, Kegels focus on contracting and relaxing the muscles that control uterine flow or the detrusor muscles of the bladder wall, the internal urethral sphincter and the external urethral sphincter. So in the Kegel exercises, what do? We need the abdominal contraction, okay? We need the contraction of the pelvic floor muscles and we need the contraction of the back muscles. So this whole area when we know how to contract and relax in the correct position, then the Kegels we can achieve. How to do that? First of all, we need to find the comfortable position. Okay, supine line is the best with the leg fold. And then we will ask the patient to try to do the action of trying to stop the urine. And and or try to stop the flatulence. How will they stop it? So they will do the sudden contraction. And while doing this sudden contraction, you will see the abdominal muscles will contract and the back muscles will contract along with it. So here we have to nullify this effect and ask them to just contract their only pelvic floor muscles. Okay. Hold it for certain counts and then relax. And it will not be easy for them to learn in one go. You have to teach them, you have to sensitize them, you have to give some biofeedback method that they are actually contracting the required muscles or not. You have to repeat it for like 10 to 15 times, 3 sets per day. It's fine. Yes, important here is to do not contract abdomen, buttocks, thighs during the Kegels. You can, in the beginning, when they don't know how to appreciate these muscles, you can start with the adductor contraction, you can start with the static back action, you can start with the abdominal tucks. But later on, you have to nullify all these effects. You teach them for them so they can, they are not supposed to contract these muscles and they have to focus only and only on the pelvic floor muscles. And there's a bridge pose exercise after Kegels. It's a yoga pose that strengthens the pelvic floor. How? I'll tell you. In this position, you see the extension. So the hamstrings are working and the back muscles are working, contracting. And so all the pelvic floor muscles are contracting. Lift your hips off the floor and engage your pelvic floor muscles. You have to concentrate there only, doing the pelvic floor muscles, doing the action of still try to hold the urine. This posture you have to hold for 10 to 15 seconds and you can repeat up to 10 times. There's another exercise which are called squats. In the squats, it's a great compound exercise that strengthens the pelvic floor, glutes and core. Do you see that's a bum coming out doing the glute area is coming out while doing these squats? It is important that position so that you have to curve your back in such a way that you can properly perform this squatting exercise. Stand with your feet with the shoulder apart, like this position, and lower your body if you're sitting in the chair, okay? And engaging that pelvic floor muscle contraction and hold that contraction for a while and then relax. Same thing you have to repeat 10 to 15 times. There's another exercise called pelvic tilts. This should be taught first actually. So while patient coming in the supine lying position, you have to train them how to tilt their pelvis anteriorly and posteriorly. Then gently move that gentle movement they should be appreciating there. Okay, same you have to repeat, hold and relax for certain counts, and you can repeat it for up to 10 times. Other exercises called heel slides, in which the patient will be lying down supine and sliding their heels through the way back to the hip and go back. Okay, hip knee extension, which is called. There's a bird dog pose. It stands with the one hand up in the air along with the alternate lower limb. Okay, so this position is also important for your PNC exercise. Okay, now the hormonal changes and their impact on women's musculoskeletal health. This is a bit tough part for you guys. So there are multiple hormones that take care of your body during the pregnancy and after pregnancy. And you can say up to the time where the body grows old and the estrogen progesterone levels deficit down. So estrogen plays a crucial role in maintaining the integrity of the musculoskeletal system, including bones, muscles, tendons, and ligaments. Menopause and estrogen decline. So when we reach up to the menopausal age, what happens? Sudden decline in the estrogen, it leads to reduce in the bone, a decreased bone mineral density, and increasing the risk of osteoporosis and fractures. It also affects on the muscle mass and strength. So muscle atrophy, or you can say sarcopenia, that means loss of muscle strength. It happens. it impacts mobility and function of the elderly women. Connective tissue changes. It affects the structure and function of the connective tissues like tendons and ligaments, potentially leading them to the increase in the risk of the injuries. Again, estrogen decline leads to pain and inflammation. It leading to pains. Osteoarthritis. Estrogen deficiency is linked in an increased risk of osteoarthritis, a degenerative joint disease. Am I audible, Dr. Paksha?
Yes, ma'am, you're audible.
Yeah, thank you.
Yes.
This is my one of the favorite hormone named relaxin hormone, and I got you guys some reviews on it. So relaxin alters cartilage and tendon stiffness by activating collagenase. This is one. Then relaxing is also involved in bone remodeling process and in healing of the injured ligaments and skeletal muscles. The soft tissue healing cascades. It's composed of 3 phases: inflammation, regeneration, and fibrosis. So the relaxin is the regulator of the both inflammation and fibrosis. Relaxin also acts as an anti-fibrotic agent and favors muscle regeneration. Relaxin hormone is mainly released in your body during the ANC period, and that's how it protects your body with the gaining the like around 10 to 12 kg of weight gain and increasing your body shape. So that's how your musculoskeletal system gets relaxed and make space for the baby. And this hormone has a very unique qualities, you can say, for muscle regeneration. Even if there's some wear and tear happening during the antenatal period, so the relaxin hormone is helping them in repairing. Role of physiotherapy in menstrual health. There's so much debate about what exercises can be done during the menstrual period, or the exercises can be done during the menstrual period when the lady is bleeding or not. So one concept says that there should be complete cessation of the exercises, gym activities, or any of the intense workouts during the periods when the woman is bleeding from 1 to 3 days. And the 4th and 5th day, when the bleeding is lower, you can resume some light exercises. But for maintaining that 28-day cycle, you cannot just exercise during the menstrual periods, right? You cannot just focus on during the when you're bleeding. For that menstrual health, you have to do full. You have to give your full time of the cycle. That means a 28-day cycle. And you have to learn what exercises can be done, how your diet should be, how you are managing your stress, because that's all is the impact of your total complete 28 days. So there are certain exercises which can help you relieving pain and dysmenorrhea, but not to be done only for those 5 days. Okay, you have to do it for a whole month and make it your lifestyle. So we will be doing for pain relief and dysmenorrhea. There are certain therapeutic exercises, like you can do some regular exercise, including stretching, yoga, pelvic floor muscle exercises, which I taught you right now, that can help reduce menstrual pain and cramps. Some manual therapy, yes, like massage, connective tissue release, and joint mobilization can help relax those tense muscles and improve your joint flexibility to reduce the pain. There is thermotherapy, which everyone takes, hot packs, warm baths, okay, to relax your abdominal muscles for easing the pain. There are certain relaxation techniques. Why I emphasize on relaxation techniques much? Because if you are relaxed, and your stress is manageable, it will automatically reduce your half of the musculoskeletal conditions. Pelvic floor dysfunction and PMS pain. So there's a role of physiotherapist. It can teach you for the pelvic floor exercises in treating pelvic floor dysfunction, which can cause pelvic pain and urinary symptoms during PMS. Biofeedback methods. This technique helps individual gain control over the pelvic floor muscles, improving functions and reducing symptoms. Education and self-management. Physiotherapists, they provide the lifestyle modifications. You have to go for the diet correction to the dietitian, stress management, and sleep hygiene, which can help your PMS symptoms. What are the benefits of these exercises? Definitely to reduce pain and cramps, to improve your mood and energy, for better sleep, and for improving your overall quality of life. Some suggested readings for the same. There's a book of DC Datta, Women's Health Sapsport. Then there's Caroline Kistner, Therapeutic Exercises, ACSM's Guidelines of Exercise Testing and Prescription. And there's one more book for the Garb Sanskar. Take care of each other, guys. Thank you, Dr. Paksha.
Thank you, ma'am. Ma'am, questions?
Yes, I'm up for the questions. You can ask.
Ma'am, when to use electrotherapy for pregnant women?
Electrotherapy is
If
not
they
generally
have,
recommended, but there are certain TENS which are required, which you can use, because the TENS they are coming in the very much patient-friendly way. So yes, you can use TENS for the low back ache, but again, I will not recommend the higher intensity one. Okay.
Ma'am, which month and when to avoid if necessary?
Which month and when to avoid? No, it's for the TENS. This is not the if there is low back pain, the thorough evaluation will be done by the physiotherapist, and if the and after the evaluation, if the patient under the supervision of physiotherapist only, they can give the modalities. So which month to be avoided? It's not like that. Definitely, but not in the later months of the pregnancy. To improve, if so, the contractions will not start. But again, TENS has not that much power to increase your contractions.
Okay, ma'am. And ma'am, one more question. Sitting down posture can be avoided, or is it to be avoided in pregnancy? Or it
Sitting
is
down
not
posture,
to be
that means
avoided?
you're squatting down, like in the Indian toilet.
Sitting down on the floor or using Indian toilets.
I can't hear you.
Sitting down on the floor or
Sitting
using
down
Indian
floor.
toilets.
No, definitely not. If see, what to avoid and what not to avoid has a very simple way of finding. So anything the women who was before pregnancy, she was able to do the things. She can definitely go to those things during the ANC period as well. Okay, and it 100% affects and you can say it 100% affects on her joints, like how they were in the before pregnancy, and her flexibility. And if you're trying, like somebody who's a computer worker, software engineer, she never sat on a floor before pregnancy, during pregnancy, and 3 years before pregnancy as well. She is using always chair and the higher seating. And if you ask her to sit down during pregnancy on the floor, then definitely it will cause some or other problem.
Okay, ma'am. And ma'am, there are many myths about SWD and pregnancy usage. So, what would
Paksha,
be
I'm
your
not able
comments
to
on
hear
it?
you clearly.
Ma'am, there are many myths about SWD and pregnancy.
Okay.
So,
Yes.
what would be your comments on that?
SWD is currently under a lot of conflicts. So, and it should be avoided during the pregnancy.
Okay, ma'am. Ankita, are there any questions?
No, ma'am. Thank you so much for your wonderful seminar. I think there are no questions remaining. One second. Yes. Okay, so we would conclude the seminar. Thank you, Dr. Amrita Tumar ma'am, for such an insightful webinar. We extend our heartfelt gratitude to you for sharing your expertise and valuable insights in this empowering session. Your knowledge and dedication to physiotherapy have greatly enriched our understanding of rehabilitation and wellness. Your contribution is truly commendable, and we deeply appreciate the time and effort you have invested in making this session impactful. I would like to thank the IAP Women's Cell for their unwavering commitment to promoting physiotherapy and empowering women under the esteemed guidance of Dr. Ruchi Vashne ma'am, National Head, Dr. Pooja Kamre ma'am, Zonal Head, and the Maharashtra IAP Women's Cell State Team, Dr. Suvarna Ganvir ma'am, Dr. Snehal Patel ma'am, Dr. Uttara Mohan, Dr. Priya Karande, and Dr. Nirali Sangvi ma'am. This event has been a true inspiration for the physiotherapy committee. Our sincere appreciation to the IAP Women's Cell Nashik district team, to Dr. Paksha Kamre ma'am and Dr. Ankita Hase. Your efforts have played a vital role in ensuring the success of this event. And special thanks to Dr. Nagraj sir for helping us cover this webinar smoothly and effortlessly with your digital expertise. And lastly, I would like to extend the gratitude to all the physiotherapy committee who are present in this webinar, whose enthusiasm and active participation has made this webinar even more meaningful. Your eagerness to learn and grow in this field of physiotherapy is truly inspiring. You're the future of the profession, and your dedication ensures that the path ahead remains bright and impactful. May this session be a stepping stone to many more such initiatives that inspire, educate, and uplift. Thank you all for dedicating to making strong women, strong bodies, and strong lives.
Thank you, Dr. Ankita Hase. Thank you, Dr. Paksha
Thank you.
Kamble.
Thank you, ma'am.